Hello and welcome to the topic of approach to a patient with sepsis. By the end of this session, you should be able to define and explain sepsis, outline the early recognition steps and management of sepsis, describe the monitoring that should be done in sepsis care bundle, and discuss the complications and management of complications of sepsis. Let's get started. Sepsis is a syndrome of physiologic, pathologic, and biochemical abnormalities induced by an infection. Sepsis is a life-threatening condition that arises when the body's response to infection causes injury to its own tissues and organs. It is a part of a continuum of an inflammatory response syndrome which is triggered by an infection. Here is the continuum of an inflammatory response which begins with an infection. This triggers a systemic inflammatory response syndrome which is also known as SIRS. SIRS is defined as a non-specific clinical response which includes two or more of the following criteria: a core temperature of more than 38 degrees or less than 36 degrees Celsius, heart rate more than 90 beats per minute, a respiratory rate more than 20 beats per minute, or a partial pressure of carbon dioxide of less than 32 millimeters mercury, white cell count of more than 12,000 cells per millimeter cube or less than 4,000 cells per millimeter cube. Besides infection, pancreatitis, burns and trauma and other insults can also lead to SIRS. Before we proceed with the continuum, let's take a look at how does the systemic inflammatory response get triggered and what follows. As microorganisms invade and multiply in the circulation, humoral, cellular, and complement as well as cytokines responses get stimulated. In SIRS, what happens is that the existing immune system in our body responds to a noxious stimulus in an exaggerated manner, causing destruction rather than protection. The criteria mentioned in the slide before this should be put into clinical context of the patient as we diagnose SIRS, because a person who had just completed a run also may present with tachycardia, tachypnea, and is surely not sepsis. In short, in context of sepsis, SIRS is the body's exaggerated immune response towards an infection. So sepsis is SIRS with a presumed or confirmed infection, either based on bedside or clinical findings in corroboration with laboratory investigations. This simply means that if a person who has SIRS coupled with a source of infection identified either through clinical signs such as purulent or pus collection or an inflamed area with elevated C-reactive protein or positive cultures, this indicates sepsis. Severe sepsis is, of course, the most severe form of the disease. At least one acute organ dysfunction is present, either respiratory, cardiovascular, renal, hepatic, hematological, central nervous system, or unexplained metabolic acidosis. Let's look at the clinical presentations. So symptoms may include fever and chills, very low body temperature, passing urine lesser than usual, rapid heartbeat, nausea and vomiting, diarrhea, fatigue or weakness. And when it comes to signs, it also resembles someone being or appearing ill and lethargic, tachycardic, febrile, with drastic body temperature changes and mental decline. These are the lab tests that can be done. So doctors generally perform lab tests that check for the signs of infection or organ damage. Examples include a urine or stool sample or a wound culture if there's an obvious small sample of the tissue, skin or fluid that is taken from the infected area. You have respiratory secretion testing, which is a sample of saliva, phlegm or mucus. Of course, a full blood count to evaluate the red and white blood cells as well as the platelets. Lactate levels, increased levels can indicate organ dysfunction. Blood gases to evaluate oxygen in the blood and acid-base balance, as well as coagulation screen. So what level of CRP here indicates sepsis? A plasma CRP of more than 50 milligrams per liter or more is highly suggestive of sepsis. Imaging studies. Medical imaging is the technique and process of imaging the interior of a body for clinical analysis and medical intervention. Here, you may need to perform a chest x-ray or an abdominal ultrasound, or if indicated, a CT, thorax, abdomen or pelvis, depending on the location or possibility of source of sepsis. When it comes to management of sepsis, it is important to initiate antimicrobial therapy targeting the most likely pathogen, of course, and removing the source or draining the infected foci. Intravenous fluid resuscitation is important to restore tissue perfusion and should be done immediately. If needed, transfusion of blood products or vasopressors can be started when the mean arterial pressure is not greater than 65 mm mercury. Early goal-directed therapy is management of severe sepsis during the initial 6 hours of diagnosis. The sepsis needs surgery. So surgery may be needed to remove sources of infection such as collections of pus, infected tissue, or dead tissues such as gangrenous tissues. How about the complications of sepsis? So what are the possible primary complications? We want to think about kidney failure, tissue death, permanent lung damage from acute respiratory distress syndrome, permanent brain damage, post-operative sepsis with life-threatening multi-organ failure, and long-term effects could be post-sepsis syndrome. So what are some secondary complications from sepsis? As sepsis worsens, blood flow to the vital organs such as your brain, heart, and kidneys become impaired. So sepsis may cause abnormal blood clotting that results in small clots or burst blood vessels that damage and destroy tissues. This is known as disseminated intravascular coagulation. So in summary, we have looked at what sepsis is, which is a syndrome of physiologic condition that has progressed to a life-threatening condition in response to an infection to the body. It is a continuum that begins from SIRS to sepsis to severe sepsis and finally septic shock. You should understand the clinical manifestations and be able to recognize them early. Understand what are the investigations that can be done by the bedside, lab tests as well as imaging studies, and discuss the management as well as the complications of sepsis. We have come to the end of this session. Thank you.